thoughtful ideas and suggestions for guests and topics.
Great events, programs, and student documents.
All the countries are using
Welcome to this week's segment of Dialogue Houston. I'm your host, Lawrence Payne. To our regular viewing audience, welcome. To those joining us for the first time here for HCC's TV Dialogue Houston, we can be found now every Tuesday and Thursday at 6 a.m. and again at 6 p.m. To our regular viewing audience, let me thank you for your thoughtful calls, emails, and text messages concerning previous shows we've aired here on HCC's TV Dialogue Houston, but particularly your great ideas for topics and guests and subjects to be covered on upcoming segments of Dialogue Houston. For after all, this is your community affairs, public affairs show proudly here on HCC TV, now in our 30th season. We look forward to you joining us as we come to you every other week with great guests and great topics of interest in our community so that you will know about great leaders doing work across the spectrum of our community in the areas of their chosen field. So we're very happy and proud to have one of those with us this week, who is none other than Lindsay Lanagan, who is going to talk to us about healthcare, but healthcare from a very special perspective because she is with Legacy Community Health. She is Director of Governmental Relations and Public Policy. And in that role, she has a wide spectrum of opportunity to view the whole discourse of what's happening in public health and health in general. And I'm just so happy to have Lindsay join us this week. So without further ado, welcome, Lindsay.
Hi, thank you all so much for having me. Absolutely.
Well, let's dive into the great history of the organization you're working with. I mean, Legacy has such a great history, 40 years now in our community of doing great work. And the thing that always struck me about it and what I always loved about it was, I think it's part of your slogan, even treating the whole person and the family under any kind of needs that they have. That's really a great, noble mission to have. Tell us about that.
Yeah, absolutely. And I have to say, I get up every single day and feel so grateful to work for this organization. I had some jobs in the past where, it felt like work. This has never felt like work to me. And so I just have to say that Legacy's done such a good job to create a culture and a mission that all of us that work here know the mission, and we're all, sort of driving towards that. And we say that driving towards healthy change, right? So to give you a brief history about Legacy actually started as an HIV STD clinic. And it's one of those things where it started in the 1980s where the HIV crisis, the epidemic was happening in the Houston area. And so many organizations and the medical community as a whole were entirely afraid to treat an HIV positive patient, right? I mean, we had issues with, and I obviously wasn't here during that time period, but we had issues with just the cleaning crews not wanting to come into our facilities, those kind of things. There was a huge stigma associated with HIV, and Legacy got its start really saying, no, we're going to be the provider that treats anyone that walks through our door, regardless of their ability to pay for the specific patient population. Now, down the road, as FQHCs, which is called a federally qualified health center, it's also called a community health center. When those became created and funded, Legacy was sort of looking at how to grow and provide the kind of care we wanted to provide to anyone that walks through the door, to a larger swath of individuals, especially around primary care, because we saw in the Houston area, the issue of providing primary care and the access to primary care was really limited at that time. And so we became a full service community health center at that time, and also a Ryan White clinic. And so Ryan White clinic is sort of a payer of last resort. So if you have no insurance, if you, you don't have any ability to have access to healthcare and you are HIV positive, you're put into a program that's funded by the federal government called the Ryan White program. And part of that program is full service wraparound care. You have a caseworker that helps you sort of manage your medications and your treatment, even things like housing insecurity, food insecurity. That caseworker is really dedicated to you so that you're treating the whole person. And so because we got our sort of start as a Ryan White clinic with that with that thought process of delivering healthcare, when we moved into the FQHC setting or the community health center setting, we approached primary care in that same thought process, right? When a patient walks in our door, they're receiving services that are primary care, vision, dental, behavioral health, and also a lot of social work aspects. So if you're having some legal issues, we have medical legal partnerships, things like that. And so we're treating the whole person. And so we've grown so significantly in the last 40 years. You know, we're now the largest community health center in the state of Texas. We're also the largest Ryan White clinic, treating 5,000 HIV positive individuals, or people living with HIV a year. And so that really has, because of our roots, it has dictated how we approach healthcare now.
In that growth process, you've served so many people who have not had access to healthcare, and the wraparound model of services is really great that you've applied to the community health that you learned from the HIV. I remember back in the 80s when HIV was kind of misunderstood, that the Montrose Clinic was really the only place
Yep.
that was willing to accept, willing to even talk about, willing even to use the words HIV. And that whole area, and that whole Montrose era, was just something that you had to kind of live through, because what you realized throughout that, and to everybody's credit who stepped up to the plate, these were human beings, just like all of us. They needed our care, our love, our support. They needed the nurturing and all that we could do. And it was so great to have at least one place in the city of Houston where you could turn to, where you could go for those services. And as you've grown from HIV to community health, as you said, to take that same model of the wraparound services to this, it's really kind of the thing that has made it's a game changer. Because not only, as you said, you're serving the whole person, you're serving the whole person with all the needs and the issues that they come to the table with. Right. Not just one little healthcare issue. It's all the other things, from social services to all. Tell us a little bit more about that, because people don't realize how interconnected and interrelated all these are, and it doesn't work in other ways if you don't have that.
Absolutely. So yeah, I mean, social services is probably one of the most important aspects. So whenever someone that enters our clinic has an issue that's outside really of the scope of their own health, right? Their blood work, their mental health even, they are referred to a social worker if they need additional supports. But there's another aspect to that. And we have what's called an Office of Social Determinants of Health. That's really fascinating. So because we're realizing more and more that healthcare has so much more to do with housing security, food insecurity, transportation insecurity, and honestly, utility security. That's been a huge issue that we've tried to address. We have partnered with the U of H School of Social Work. We've partnered with TSU Social Work, as well as just the school in general, to really house individuals at each one of our clinics that screen our patients that come in for those insecurities, and then are able to connect them to the resources that they need. Because for us, a patient, it's very difficult to be healthy as a whole if you are worrying about where your groceries are going to come from, or if your lights are even going to stay on. And so that has been a huge aspect. So not only are we partnered with in those universities, but we received an AmeriCorps grant from the federal government to place those individuals. They're salaried individuals that are in our clinics that really help. So they work with the social work team to just make sure that everything else that revolves around a person's livelihood and their health is not just what their blood pressure is, it's also, do they have a healthy environment around them? And that's what's so important. And so I have to also thank the Episcopal Health Foundation for helping us achieve those goals, because they are an absolute believer in the fact that you treat the mold in someone's house versus necessarily the person that has to go repeatedly to the doctor's office because of the mold in their house, right? It's just a different aspect of looking at healthcare. And so we've embraced that fully at Legacy.
So systemically, as we approach these issues from the social determinants of health, a lot of it revolves around poverty, but a lot of it also has a direct connection to social justice or injustice. That we find people living in conditions here in Houston, Texas, in the fourth largest city, et cetera, yada, 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 that people would not believe that this is Houston. that some of the conditions you find people living in neighborhoods and communities that you can't even fathom, because that can't be, not in our city, not with all the abundance that we have and everything else. But we find more and more how true that statement is. We have people really, because the system, and it is a system issue, has failed them greatly in almost every aspect of their lives.
Yep.
And of course, poverty is the driver.
Yeah, I can't agree more. Look, I mean, 98% of our patient population is at or below 200% of the poverty line. And 85% of our patient population is minority. They're Latinx, they're African American, Black, and they're Asian. So if 85% of our patient population is experiencing poverty, and it happens to be these specific minorities, there's an issue. And that's something we definitely want to work on at Legacy. It's something that I'm incredibly passionate about from a policymaking perspective, because I do policy day in and day out at the state level, at the federal level. And you're seeing a lot of traction that's happening at the federal level around equity. And we're fully engaged in that work to say, why is this happening, right? And how do we elevate and help bring the issue to light, but also correct for the issue and provide all the supportive services we can to make a change. And that's got to be like first and foremost of what we focus our efforts on.
In your work in public policy and in trying to make those changes, significant policy changes, why do you see, and why is the issue of equity? There are two words that you get in trouble with some circles if you use. Social justice is one of them, equity is the other one. And equity, if understood properly, really in a way will help a lot of other issues, because if you're doing equity the way it should be done up front, you end up cutting your costs and paying less on the back end by not doing it.
Yep. So
there's a direct correlation between helping people understand that equity is the key issue to getting all these things resolved. Why do you find it so hard for that connection to be made, or for that lesson to be learned?
I really wish I had an answer for that, to be honest. I do talk with a lot of legislators who express that very thing. Why is this so hard, right? I will tell you, Legacy's number one priority next legislative session is really to get a reimbursement in Medicaid for social determinants of health work. If you look around the landscape of who's doing this kind of work, we're all grant funded, right? We're all depending on grants every single year to continue doing this work, or partnerships or things like that. If we had a system that actually invested in social determinants of health, and we were incentivized, other providers were incentivized to do that kind of work, you're going to see so many more people engaging in that work. We have to scramble every single year to create the social determinants of health office. And that shouldn't be the case. It should be recognized in healthcare that treating the whole person and making sure that people have their lights on, food available to them, especially healthy foods, right? And transportation is an absolute part of treating the whole individual and making a healthier individual as a whole. So that's something we're really focused on. I think by the end of the legislative session, I'm the kind of person that goes in and I do not take no for an answer. So I'm really hoping that I can come back to you, 2 years later after our next legislative session and told you we were able to get this done. But those are the kind of discussions I think we're going to see rise to the level next legislative session. And I'm excited about that. I'm hoping that there's some what's called interim charges, where the state discusses things when they're not in legislative session, where we can really talk about the data, because we're collecting data at Legacy that shows it is cheaper in the long run to address these issues on the front end than have someone having to keep coming back, right? And not only to say just for your overall physical health, but for your mental health, having to worry about all those different things causes mental health issues. It's absolutely apparent that when you're completely insecure in so many different areas, that there is a mental health aspect angle to that. And so we want to be able to prove that this is best for the overall healthcare system to treat the whole person and to do it at the front end versus just reimbursing for medical healthcare visits. And so I think that is going to be exciting to see how this unfolds. I've talked to a lot of people that are skeptical about this sort of theory, and they're starting to come around as you show them the data. And so I think we have to be armed with data to prove our point.
When did we fall in love so deeply with charity and the reactive kind of responding to issues, and can't even see the proactive side of doing it from a justice standpoint, that we're locked into this model that we say we care about the whole person, but to help the whole person become self-sufficient and become independent is a model that we should be moving toward, that independence, but we keep relying on people being dependent, and we keep them dependent on us as a system, when yet at the same time we advocate and we preach the other. It seems that there's so little disconnect, and I think part of the disconnect for me, as I look at it close over these years, has to be an ethical question. I think it really boils down to as much of the ethical issues of the politics and the policies needing to be discussed, as you said, in the interim, needing to be being discussed across the board, across town hall meetings, across all kinds of legislative gatherings. We need to be talking about what are we doing in service to human beings?
Absolutely.
And why are we determined to keep them dependent when we keep saying we want every human being to be fully realized, actualized, to be their own self-sufficient human being, and we do everything that goes against that?
Yeah, I couldn't agree more. And if you look at the policy of just Medicaid expansion in general, right? The state has repeatedly denied the, healthy adult male populations, essentially healthcare, right? When you look at who's actually affected by not expanding Medicaid, it's generally that adult male population, right? And so you're right. I mean, if you want people to be independent and grow and, get off the system, you have to help people to get off the system, right? And it doesn't help anyone to have no health insurance whatsoever. And I think that's one thing that it's so frustrating from just the amount of uninsured that we see, that there's no opportunity for help other than charity at this point. And we do a ton of, we do a lot of uncompensated care. But it's incredibly frustrating to see the state moving, away from helping others. And that's largely been in the form of Medicaid expansion. I will say that we were able to get a really important policy put in place last legislative session. So if you're a new mom that's on Medicaid, you had your baby, you were kicked off of Medicaid essentially 60 days post-pregnancy. You were moved into a smaller, what's called a benefit package, so a smaller list of services that are available to you, called Healthy Texas Women's. But you were really only moved into that unless you were a high-risk pregnancy. We were able to secure last legislative session a full 6 months post-pregnancy that the mom would be, able to have full Medicaid benefits. And that's so important in those first 6 months of a mother, but also the baby's life, that they are both healthy and happy and stable. And so that was a huge win that we received last session, and we were thankful for it, but there's just so much more to go. We were trying to get 1 full year, that's really the standard. That if you look at other states, it is 1 year, but we were able to secure 6 months. And I just feel like we're taking little baby steps, and hopefully we can get to a place where we can treat the whole person. And I think social determinants of health is really important to discuss next session. It may be a baby step, but it's something to look forward to.
When you meet with the legislators and their staff, what do they tell you? That they're just not hearing enough from their constituents, that they just don't hear enough of the outcry, hue and cry for these issues and concerns? Because obviously, if that's the case, then we need to do more on that side, to have constituents through whatever vehicle, town hall meetings or whatever, so that the elected officials can hear directly from them that this is something we care deeply about. We always say, well, the way you always correct that is at the ballot box. Well, that's not necessarily always true, I've learned over the years. is getting that person in front of their constituents at a town hall meeting and holding them accountable at that meeting, getting direct yes or no answers from them. You will do X, Y, or Z, yes or no. That's what makes the difference. And until we can get that kind of momentum going as a movement around these issues, I don't think we're going to be that successful. I know that you and other groups around the city pair together and do some of these forums. Maybe we need more of those educational forums.
Yeah, I will say, I think legislators have largely heard from so many people about Medicaid expansion and the need for it.
Right.
I think, honestly, what's missing is the business community being involved in that discussion.
Okay.
To me, that is one of the things that legislators very much listen to is the business community. And they recently did, last legislative session, the Metro 8, which are the large kind of the chambers of commerce from the large 8 cities, they did get together and put together a letter that called for Medicaid expansion. The governor wasn't super interested in that. And I don't think we didn't even get a hearing on the Medicaid expansion bills that were proposed. So, but a letter is a good start. But honestly, large businesses saying we have to be able to provide this for our workers, but also for the workers' families and things like that. That's really important. And I think what has lacked in the discussion has been the involvement of the business community.
Well, I remember that letter now that you mention it. I do remember the letter from the various Chamber of Commerce. In fact, Great Eastern Partnership, they made sure that they knew that the letter got out, let everybody know that they were partners to the letter. But it seems to me that the receptivity of those in Austin and the governor's office and others related, it's just not there when it comes to the worker. Even with big business advocating for their employees, for their workers, there doesn't seem to be a receptive ear. They're focused on other issues. And because they're so focused on those other issues, unless the business community through their advocates and their lobbyists are literally beating down the door.
That's exactly right.
An audience on this, literally beating down the door to get an audience on this issue, it's not going to happen. And I think they push, but like they always say, how hard do you push? Well, I push. Well, then go back and push some more. That's always the refrain, the response. So I just think that maybe as we get into the preparation for this next biennial session, that maybe this can be taken up again and the business community will re-urge in a stronger way their administration to do something. So all we can do is hope.
Yeah, absolutely. And, and like I said, I think there are definitely some bright spots and some baby steps that are being taken to address some of the populations. And I think we as Texans, we have to be creative. And so in the absence of being able to necessarily completely get the whole package that we want, I've always focused on, okay, if we can't get this whole package, what's something that we can do? What's one thing that we can do? And so every legislative session, Legacy focuses on one thing that we can do that will really make a difference. And that 6 months of coverage is a huge deal for us. And the other thing is
a great step.
It was a great step. And so that's really the focus, is just moving towards baby steps at this point. But at the same time, really hoping that we revive those discussions as well, because it's absolutely necessary.
Well, in an attempt to get people's ear, both elected and others, early voting has started. So we encourage everyone to go vote. Early voting is in process now for the March 1st primary. So please avail yourselves of that. Well, I want to switch gears in the few minutes we have left with you, Lindsay, and talk about a project that you're involved in called Houston Task Force 2036. It is an idea that has been born to really look at 14 years going forward to our 200th anniversary as the city of Houston in 2036. What do we want the city to be like, act like, feel like, talk like, behave like, treat other human beings like in areas of education, healthcare, your area, and in environment. Tell us a little bit about that process and thus far. I know you're just beginning it, and what your thoughts are of it going forward.
I think, first of all, this is just such an exciting project. I think we all the people that are in the room are completely committed to devoting their spare time to really focusing on where do we want to see the city in 2036. And we started off that conversation with a presentation by Stephen Kleinberg that really highlighted, what we need to focus on to have a thriving city in the future. And so one of those focuses is got to be on healthcare. We have the highest rate of uninsured in the United States here in Harris County. And that is absolutely, that's not something we should be proud of. And we have the highest rate of uninsured, in the nation here in Texas. And so that's something that healthcare should not be a system of have and have nots. We at Legacy are going to be here no matter what, but at the same time, we also have to focus on leading the charge of changing the current system and how it operates. So I really think all of us coming together, look, I'm going to learn a lot about other industries. I'm obviously centered in healthcare, but at the same time, I'm so excited to learn more about how we at Legacy can partner with other organizations to really make changes. And the 2036 goal, right, is that we are the most diverse city in the nation, but let's also be the most equitable city in the nation.
And as we move forward on this process together, you and I and all the wonderful individuals who are working with us on this project, we'll keep you abreast here on Dialogue Houston of that progress. But I want to go back to the Legacy for a moment. You're now in 50 locations, is that correct? Did I read
54. We just opened our 54th.
54. I'm amazed because I remember when Montrose Clinic started. I mean,
that's exactly right. And just to add a little color to that, 33 of them are school-based facilities where we offer full-service pediatric care and behavioral health in the school setting. So they're the large schools with a clinic in them, which is a really neat model that we're trying to replicate.
And it's a model that works and a model that's needed. That's the other thing.
Yep.
And it only will grow. It only will grow more going forward. So the question has to become: how can Houstonians help you and support your work? Because obviously the model that you have created through Legacy for Healthcare, not only for the adult population, human being wraparound services, but also now in the schools, is the model we need going forward. So how can we all help and assist in that process?
Well, thank you for asking, Larry. We are a charitable organization, so we obviously we fundraise out in the community quite a bit to support the services. We have specific, program goals that we have a little resource program that gives free books to children. So you can donate that way. But at legacycommunityhealth.org, you can donate to our mission. And we would love it if you would participate and help us.
So go to their website, open your checkbooks up, write a little check, write a big check, write a medium-sized check, but just write a check. And support the great work you're doing. A wonderful 40 years in our community, now 44 locations across the greater Houston area, serving all the human beings that need it. Let me end with this. Lindsay, thank you first of all for being with us. Let me end with this comment real quick. I mentioned the word ethics a minute ago. Ethics is the road to empathy. Empathy is the road to equity. There is no road other than those three. In ethics, we talk about all human beings' lives matter, all human beings' lives matter, all human beings are equal. The empathy is telling our stories. Everybody has a testimonial and storytelling to be able to reach the other human being. And of course, equity is the engagement of all of our commitments together to understand how human beings deserve to be served by fellow human beings to the fullest of their God-given potential. That's it. It's not complicated if you want to get it. It's not brain surgery. It is very simple. One follows the other. As always, I want to thank you for joining us for this week of Dialogue Houston. We look forward to you joining us in future segments of Dialogue Houston. Please, until then, be safe, be well, make sure you go out and vote. And until then, until next time we see you, as always, peace, power, and love.